Hi, Premamas! We were so honored to have Dr. Stephanie Liu back in our Facebook group and YouTube for a question and answer session around PCOS and endometriosis. She's a physician and a mom herself and has experience working in women's health, postnatal care, mental health, and pediatrics. To tune in live to our future events, join our Facebook group linked in the description. Now, let's welcome Dr. Liu.
Hi, everyone. I'm Dr. Stephanie Liu. I'm a family physician. I'm so excited to be here to be able to chat with you guys more about PCOS and endometriosis. As I mentioned earlier, I'm a family physician, mom of two, Maddie and George, and also a blogger at Life of Dr. Mom, Instagram Life of Dr. Mom, and Facebook Life of Dr. Mom Stephanie Liu. And thank you guys so much for submitting your questions. I'm excited to go through these questions with you. And feel free to contact me afterwards if there's any other questions or concerns or anything you want me to highlight again. So the first question we got is a really good overview. The first question we had is, what is PCOS? So PCOS, the formal name is polycystic ovarian syndrome, is quite a common condition that affects how a woman's ovaries work. And there's three main features of PCOS. The first is irregular periods. The second is excess levels of male hormones in the body that can be seen through blood work or clinically. Some of the signs of excess male hormones are excess facial or body hair. The next feature is polycystic ovaries that are seen on imaging, often ultrasound. And to have a diagnosis of PCOS, you need two of these three features. It's interesting, though, because the name polycystic ovarian syndrome is a little bit misleading, because some might say, you know what, I must have polycystic ovaries on imaging to have this diagnosis. But that's actually not the case, because you only need two of the three. So you can have irregular periods and excess levels of male hormones in your body, and that is enough for the diagnosis. So you don't necessarily need to have cysts seen on imaging to have this diagnosis. Okay, the next question that we have is really good too. It's how do I know if I have PCOS? What are some of the signs and symptoms I should look for? So one of the symptoms, as I mentioned earlier, is irregular periods or no periods at all. Another symptom is difficulty getting pregnant. This could be most likely a result of the irregular ovulation that's often seen in PCOS. Excess hair growth is another symptom. This is normally in areas such as the face, the chest, the back, or buttocks. Weight gain is another symptom. Hair loss from the head, and typically in patterns of male pattern baldness. Another symptom is acne or oily skin. PCOS is also actually associated with increased risk of developing health problems later in life, such as type 2 diabetes and high cholesterol levels too. Okay, so the next question is a really great one. If I have irregular periods, does that mean I have PCOS? No, not necessarily. And the first thing I want to do is just say, what is a regular cycle versus an irregular cycle? Cycle length can actually vary, and it can be completely normal if you're within this range. Cycle length can range from 21 to 35 days and last 2 to 7 days. So even if you're having periods that are shorter, let's say every 21 days, as long as they're every 21 days and regular, that doesn't mean that you have irregular periods. I would say that I would still recommend you seeing a healthcare provider if you're experiencing no periods. If your periods are at irregular intervals, so for example, 21 days, then 60 days, then every 2 days, that's irregular cycle. So I would recommend you seeing a healthcare provider for that. Bleeding for prolonged periods of time, so more than 7 days, please see your healthcare provider. Heavy bleeding that's interfering with your quality of life. Bleeding in between cycles. So some of the things I highlighted is known as abnormal uterine bleeding. So please see your healthcare provider if you're experiencing any of that. Okay, we have another great question. If I have PCOS, what can I do to get pregnant? So the first line treatment for women that have an elevated weight is actually weight loss. Even just a small amount of weight loss can actually help someone begin to ovulate normally. So weight loss really is one of our first line recommendations, and it's also helpful for improving blood sugar levels too, and just overall health if you're at a higher body mass index. Medications such as letrozole can be used to stimulate ovulation, as often with PCOS there's irregular ovulation, and other fertility treatments such as IVF. Okay, we have another great question. How does PCOS cause excess hair growth? So excess hair growth, the medical term is hirsutism. And this is a condition where there's excess hair growth of dark, coarse hair, typically in a male pattern, so in areas such as the face, the chest, and the back. Hirsutism is believed to occur in PCOS because there's excess levels of male hormones. The main hormone being testosterone that can increase hair growth in PCOS. A sip of water. Thank you for all the great questions, everyone. Okay, the next question we have is, what is endometriosis? So endometriosis is a condition that can cause pain in the lower part of the abdomen and can also make it difficult to get pregnant. The name endometriosis comes from the term endometrium. So the endometrium is the name of the lining of the inside of the uterus. And this is what sheds during our menstrual cycle. In people with endometriosis, the cells that are normally found inside the endometrium are growing outside of the uterus. So the lining of the uterus is not only inside the uterus, but those cells are also in areas where it shouldn't be outside of the uterus. It's not exactly known why this happens or how this happens, but we do know that those endometriosis deposits that are outside of the uterus, they act similar to how the endometrium and the lining of the uterus acts. So just like every menstrual cycle, the tissue thickens and then sheds. But for those endometriosis deposits outside of the uterus, they're also bleeding, breaking down and bleeding, but they have nowhere to go. And this leads to inflammation and scarring in the pelvis. So this is why most people with endometriosis get pain around their menstrual cycle. So there are some common signs and symptoms of endometriosis, but it's interesting because some people with endometriosis have no symptoms at all, while some with endometriosis can have very severe symptoms. So some of the symptoms are pain in the lower abdomen during the menstrual cycle. Some people can even get pain in between cycles. Some people can have pain during sex or after sex, and they can also experience pain when they're peeing or having a bowel movement. But most of the time, these urinary and bowel symptoms occur during the menstrual cycle. And one other symptom is some difficulty getting pregnant. The diagnosis of endometriosis, we can be on history. It can make us suspect endometriosis, but really the only way to diagnose is to look inside the pelvis with something called laparoscopy. That's a surgical procedure where we look inside the abdomen to see if we actually see those endometriosis deposits outside of the uterus. Okay, we have another great question. How soon after going off meds will my endometriosis symptoms start coming back? And how do we treat endometriosis? So that's a really interesting question because, as I kind of mentioned before, some people with endometriosis, mild endometriosis, will have severe symptoms. And some people with severe endometriosis will have no symptoms at all. So it really depends on the person and their symptoms on whether or not they need treatment. And so treatment can actually, for endometriosis, we break it down into two categories, one medical and then surgical options. We normally start with medical management first. So one of the things, if people are experiencing pain with endometriosis, we start with medications to help relieve the pain. One of the medications that we recommend are NSAIDs. So this is an example of that is ibuprofen, also known as Advil. And this is one of the first line options that we do. So we recommend, NSAIDs for around the time of their period or when they're experiencing symptoms. And this can help really relieve that pain that's associated with endometriosis. Another option are birth control medications, such as the oral contraceptive pill. And we find that people with endometriosis will get some pain relief when people are put on these birth control medications, because it's similar to when we give birth control. Sorry, I'm kind of stuttering here, but with birth control, what it does, some of the birth control medications, what they do is it prevents ovulation. And so when you prevent ovulation, you're preventing some of the symptoms of endometriosis. There are other types of medications that are more last line, and these are medications that actually stop the body from producing certain hormones. And those are medications where there are quite a bit of risks, and there also are benefits to it. And these ones are just, I recommend really discussing those options with your care provider in detail. The other management strategy, as I mentioned, was surgery. So there are different types of surgical procedures. The main one that we do for endometriosis is something called laparoscopy, and that is using a camera to look inside the belly to see first, to confirm the diagnosis of endometriosis. Often during this procedure, if they see the endometrial deposits, they will actually try to remove them at the same time. For some people that are not intending on having children, or they've already had their children, one other option is a hysterectomy, where they remove the uterus and the ovaries. And this is something if really the medication management doesn't help and these symptoms are severe and really affecting the quality of life, this is another option to be considered. Okay, our next awesome question. At what point does endometriosis require surgery? Or what exactly does the surgery for endometriosis do? Okay, so surgery is typically, in general, a last line option. We normally recommend medication management, conservative treatments first. And the decision to go for surgery is a complex one because, it depends on the severity of the symptoms, what the fertility goals are, and whether or not this person is at risk for surgical complications. So all of that needs to be taken into account. So severity of the symptoms, are there issues with fertility? Will surgery help fertility? And also looking at the surgical complication rates for, for the patient as a whole. So the surgery is, as I mentioned, laparoscopy. So that's when you look inside the uterus with cameras. And sometimes during this procedure, the endometriosis, if it's visualized, will also be removed during this procedure. So the next question is surgery the only way to permanently fix endometriosis? So that's a great question. So with the medical management, the pain medications, the birth control, the medications that will alter hormone levels, it will not get rid of the endometriosis. The only way really is to do the surgical procedure. But a lot of times, surgery does not need to be completed if medical management is effective or if the symptoms are mild. The surgery, as I mentioned, is called laparoscopy. And even with, it's important to note that many people with endometriosis may have absolutely no problems with fertility, and that a full fertility workup should still be done, even if someone is known to have endometriosis. So looking for other causes of infertility too. Okay, we're down to our last question already. So the last question is, what are some natural ways to help with PCOS and endometriosis? So the management of PCOS and endometriosis is different. So I'm going to kind of split up into two categories. We'll start with PCOS. So as I mentioned earlier, PCOS, really the first line management strategy is diet and exercise for weight reduction. If the patient with PCOS is overweight or obese, even just small amounts of weight loss can really help improve insulin sensitivity, and can also help reduce the presence of male hormones, and can help with ovulation. So really, one of the first line steps for people with PCOS, we recommend, a well-balanced diet and also regular exercise too. And actually, that's, I guess, for all of us too. That's what I tried my best to practice. It's hard though. And then for endometriosis, there was actually, interestingly, a small study that was done that said that acupuncture may help relieve some of the pain associated with endometriosis. So I found that really interesting. To the best of my knowledge, there's actually no dietary recommendations that have been shown to prevent or treat endometriosis. But in general, I recommend a well-balanced diet that's rich in vegetables, fruits, healthy whole grains, and good proteins too. So I think those are all of our questions. I had a great time chatting with you guys. Feel free to send me a message if you have any other questions. And thank you to Premama for having me.